So I've been asked the question, how do you heal trauma? And that is certainly a journey that I am going on. The phrase, it takes a village, comes into it. And trauma occurs when you don't feel safe, you don't have the resources to keep yourself safe or respond or flee to get out of the situation. And I would describe it as a shock to the system, and a shock that rattles around oneself without being able to be processed, integrated and released. By released, I do mean a sense of letting go of that trauma in terms of it's not at the prefrontal mode of your thinking every day. Trauma activates you. It activates you into a stress hypervigilance response as well. Trauma is exhausting and has impacts upon our health, our mentality, and our interpersonal connections. Trauma is very taboo. When I'm saying it takes a village, we have a village that isn't really willing to talk about trauma, to help people heal from it, because as a collective society, we've not really been taught. So that's not me blaming individuals, but it is me looking at us as a collective community. We have a cultural way of keeping a stiffer upper lip. Keep calm and carry on is the saying, which is actually a modality of repression and suppression and denial, which does not promote integration of an experience. Healing from trauma can be devastatingly scary. Often in the therapy that I've done, we do something called part work. Trauma can be compartmentalized by elements of your personality that you may disown to escape what happened to you. In a lot of trauma work, it means meeting those parts, and that can be difficult because meeting those parts means that the memories can also return, memories that you're trying to survive, suppress, and disown. Remembering that trauma, almost reliving it, and your systems are re-shocked in that process. But it's working towards a form of integration. But trauma is very, very felt. And a lot of our clinical therapies are very thought-based and thinking-based. They don't give a lot of room to somatically address the sensations that arrive with traumatic experiences, such as fear, shock, horror, disgust, remorse. I'd say that our talking and thinking clinical therapies as they are not fit for service, in that they don't look at the body holistically. Many, many researchers are combating this, such as Dr. Albert Wong, Dr. Peter Levine, Dr. Bessel van der Kolk, and many other doctors and associates at the Embodiment Lab. I personally wouldn't recommend doing this part work on your own, and especially without safe containers, safety rails essentially. And that leaves people stuck in a place with unintegrated, unprocessed trauma which they can feel and which is activating their systems on an unconscious level. With waiting times as dire as 2 to 3 years, our current medical setup is robbing people of the chance of autonomy and personal growth and reconciliation. I think trauma recovery is possible. I think it takes a lot of work, a lot of somatic principles, as well as the talking and the thinking, moving to help that nervous system regulation. But one thing that trauma recovery definitely requires is the time and the right space to heal from trauma. It's pretty impossible to heal from trauma when you're in an environment where you're being traumatized, abused, or you're at the risk of re-traumatization. So environment is really key. And also time is as well, and space. And that, we know, is a commodity that is heavily shaped by the capitalist fundamentals that we have formulating every Western society. So there's no clear answer. The only thing I can advocate for is that you do deserve to carve out the time and the space for you. You do get to address those feelings and emotions with a counter-narrative, the theory of neuroplasticity, which is, I am safe now if you are safe. I am safe, I am secure, I am home. What happened did not deserve to happen, and undoing that victim blame narrative that is so heavily precedent within our cultural dominant narratives.